And welcome back. Well, it started in the year 2015 through a partnership with Harlem Hospital. The HOPE program was created to educate and build awareness of hospice care and its benefits among Black and Latino New Yorkers. With COVID-19 shedding light on unpredictable situations where you may be in the hospital and can't have trusted loved ones by your side, HOPE also works with patients and families so they can understand advanced planning. Here now to share more and tell us is the director of VNSNY HOPE program, Michelle Drayton, and VNSNY HOPE Clinical Liaison, Clarissa Santos. And thank you both for being with us here on the show. And I know Clarissa's in the middle of work itself. Michelle, give me a little bit about the work that you guys are doing, as we said, talking about really reaching people at a critical time.
Daren, thank you so much. It's an absolute pleasure to be with you. And yes, Clarissa, as an RN clinical liaison, is on her way to see a patient. This is the work that we do. The HOPE program was developed to really address the gaps in access to care, similar to what we're seeing in terms of COVID, whether it's around vaccinations or access to primary care. And the HOPE program stands for Hospice Outreach Patient and Provider Engagement Program. And we're really focused on ensuring that people, particularly African Americans and Latinos, in the Bronx and in Harlem have access to hospice. And there are a lot of myths and misperceptions around what hospice is. And our program really works to debunk those myths. Hospice is one of the most comprehensive services that patients can access when they're terminally ill. And we're really also prioritizing the need to understand what advanced care planning is. I think many people are finding themselves in situations where they may end up in a hospital and they don't have an advanced care plan. They don't have a healthcare proxy who knows what their medical wishes are should they become unable to talk about that. Also to make sure that they are clear about life-saving, practices.
Yeah. Clarissa, talk to me a little bit about the work that you do as a liaison. Obviously, that's a go-between. Talk about how you work as a liaison.
Well, we get referrals from the community, from the hospitals that we partner with, the nursing homes, sometimes from physicians. My job as a liaison is basically to take that referral, first of all, introduce myself to the family. Recently, I've been dealing with a lot of Spanish-speaking families for which the language is a big barrier. So I basically speak to the patient, if possible, the family, basically tell them what hospice care is, they were referred, and just basically answer any questions that they have. Basically, once they understand and they accept it, and I've gathered the information I need, I speak to a doctor from VNSNY, just to ensure that they are eligible for hospice. And from there, I hand it off to our team, who then admits the patient into our program. And at that time, the patient has our full support 24/7. As we tell the families, a lot of times, because of the language barrier, sometimes they don't know told this. In the hospital, sometimes they might not be a Spanish-speaking social worker or someone in the hospital who can tell them about this. So I'm usually the first person who basically informs them about how hospice and palliative care can be beneficial to their relative.
Right. And when we talk about breaking down those barriers, I mean, it's very important. How big and how huge are those barriers? To the average person, they may not think they're huge because they're not as intricately involved. But for those of us who have the working knowledge, it's a pretty huge barrier.
It's huge, Daren. On a national level, when you look at hospice utilization, first and foremost, New York State ranks far below. We're 49 out of the 50 states in hospice utilization. That means that people who are eligible for hospice are not getting the information, whether or not they're in the hospital and they're terminally ill, that there really should be an option. Whether I choose aggressive therapy or I want to just focus on comfort and pain management. When you drill down even further, you look at, the white population at a national level. They represent around 70% of those that are on hospice. African Americans, it's only about 7.5% or 8%, and Latinos is only 6%. When we drill down even further into New York State, and this is a state that has the most sophisticated medical services and technology, our utilization rate of hospice is only 27%. And that's for all populations, Medicare population in particular. But hospice is available to anyone at any age. So if you are terminally ill, if you have multiple hospitalizations, if you're not getting better, the most important thing, and this goes with anything, is that you have to have the right provider. You have to have the right relationship with your healthcare provider so that you can have the conversation. And Daren, unfortunately, oftentimes it is Visiting Nurse Service of New York that's being called in to talk to the patient about, their illness, rather than really having sort of that discussion very thoroughly with their physician. So that's one of the primary barriers.
Yeah. And we're seeing more and more Black Americans really work in the field of home health care. Am I correct?
That is absolutely correct. And that's one of the major risk factors when you talk about COVID-19, whether or not you are a home health aide, a registered nurse, a licensed practical nurse, or a social worker, you're working in hospital facilities, and oftentimes, coming in contact with patients. And so, yes, we are the essential workers. And it's just critically important that everyone in the community knows about hospice. There's no financial barrier. It's part of one's Medicare benefit. If you're not of Medicare age, then you can access it at any age. We take Medicaid, all insurances, and we even do charity care. Visiting Nurse Service of New York has really been on the front lines of addressing disparities. And that's something that we're really focusing on now, is really focusing on racial inequities, whether or not it's hospice or other, healthcare services. We want to really begin to close that gap.
Clarissa, Michelle used the word gap, and I want to talk about that gap for a minute. As a Latina nurse, do you feel that the work that you do helps to bridge the gap, given the fact that sometimes people are very uncomfortable or just don't know?
I definitely do feel bridges being, like I said, the main barrier I've encountered as a Latina nurse and in the Latino community is the language barrier. A lot of times, even when the primary physician speaks Spanish, sometimes even they're not able to convey the information the patients would need. Had a recent case of a patient who was admitted to our service, whose family honestly said that they had accepted a referral, they were interested, but they didn't really understand what it was. So I sat with the family for about a good hour, explained to them the unique situation about how their relative would benefit from our service, what we can do. And they were just very thankful afterwards. They just said they were just so relieved that they would make the right decision for that relative, and that that this person would be basically guaranteed to be at home. I know both in the African American and Latino communities, family is very important. We're taught from a young age that we take care of our own. So a lot of times when we see our mother, our father, our aunt, some relative going into the hospital, we're being told that it's basically nothing we can do at this point. The decision is, do we leave them at home where we can surround them and be with them, but not be able to provide them the medical care they need, or do we leave them in the hospital? And with these times of COVID, a lot of times leaving your parents or your loved ones in the hospital might mean that you might not see them again, despite the communications that a lot of places have. I work in a nursing home before I came to VNSNY, and we did have, for example, relatives who could video chat with their relatives in the home. But some places might not have these facilities, so often making that decision is very hard. So being that VNSNY and the HOPE program can bring this bridge, can allow the person who's ill to be at home, to be surrounded by family, and still receive all the medical attention they need. It's just such a relief to these families and to these patients. And I feel that they're more at peace. if a patient knows that they're able to be at home, knowing they might not have much time left with their loved ones, knowing and no time do they have to leave the loved ones, they can be with them, is just such a relief. And I think it benefits both the patient and the families.
Well, Clarissa, Michelle, we got to leave it there. Thank you so much for joining us. But I do want to say thank you for the work that you continue to do in impacting people at a most vulnerable time. And so want to let you know, if you want more information, be sure to visit them on their website, vnsny.org/hope, or you can call them at 212-609-1900.